When a person is affected by a neurocognitive disorder, such as Alzheimer's disease, communication can become more difficult, especially when other conditions also interfere. Communication is the key to relating to others. It's a way to express needs and concerns. It is therefore normal to feel impatient or discouraged when having difficulty communicating. These emotions reflect our desire to engage with others and can be shared by both the person living with the difficulties and those around them. If you know someone who has difficulty retaining information, but also in hearing, seeing, or expressing themselves, this capsule is for you. It offers you tips on how to better communicate with them. Before adapting your behavior, it is important to understand the three main elements that can affect communication. First, the functioning of the senses. These are mainly auditory and visual problems. As we age, the ear stops hearing high-pitched sounds. It becomes more difficult to discern words, especially if there is noise around. Having trouble seeing can also change the way we interact with others. For example, it becomes more difficult to read lips or to decode facial expressions. The second area that affects communication is mental function. These are difficulties in remembering, understanding the meaning of words that we hear, or finding words. The mental effort required to communicate can put the person in a state of overload that causes a loss of ability to cope or makes them withdraw. Often the person knows what he or she wants to say, but the connection between thoughts and words is disturbed. And finally, difficulties in using the muscles of the face or throat can make communication more demanding, affecting, for example, articulation, voice control, or facial expression. If you want to relate to a person with communication difficulties, your approach can make all the difference. Keep in mind that communication difficulties are often a reflection of changes in the brain and that the person does not have bad intentions. Focus the interaction on maintaining the person's dignity, building on his or her strengths. Taking the time to connect with the person, to look beyond the illness to this individual's life history and interests usually facilitates the exchange. The idea is to let go of your usual way of communicating and let yourself be guided by the person's reactions. Here are a few tips to encourage a constructive exchange. Before the conversation, choose quiet places or reduce background noise to avoid information overload. Verify with which ear the person hears best and position yourself accordingly. Also, make sure the person has a clear view of your face. Make sure you have the person's attention before you start the conversation. Make sure the person can hear you and remind him or her not to hesitate to ask you to speak up or repeat yourself if necessary. During the conversation, show that you are listening and try to gain the person's trust. If the person wishes, you can hold hands or put a hand on his or her shoulder. Speak more slowly than usual and calmly. Use familiar words and simple phrases, but avoid childish language. Choose questions that can be answered with a yes or no, or give a choice of two options. Be sure to allow time for the person to respond. Encourage the person to actively participate in the exchange. Be aware of the person's nonverbal cues, gaze, and gestures. Encourage him or her to express their feelings. For example, you might say, "I think what I just said upset you, did it?" Include the person in group conversations and avoid talking as if they were not there. Don't be afraid to use humor to relax the atmosphere, such as laughing together about misunderstandings and de-dramatizing them. Even with these tips, it is normal to have good and bad exchanges. It is important to remember to listen to yourself and to the other person, to respect your own limits, but also to take full advantage of the good times you share.